Hello family, today let's talk about something in medicine we call testicular torsion. Let's define what testicular torsion is. Torsion means it means rotation. What happens is the testes hangs up in the scrotum. The way they are made is that they hang on a structure in the scrotum, a structure we call a spermatic cord. And in this spermatic cord, there's a nervous system, there's the blood vessels, and there's the spermatic duct. So what happens is when this structure rolls, the blood flow to the testes is cut off. So we end up having having testes which do not have a blood flow, and if we don't get a medical intervention, then we'll end up losing your testes. And what happens is, if there's torsion, the medical intervention is supposed to occur within 6 hours of torsion. If we don't have the medical intervention within 6 hours, then the testis dies and we end up losing the testicles. What are some of the symptoms when you are having this medical condition? One of the symptoms could be the swelling of the scrotum, and the second major symptoms could be an acute onset of testicular pain. And I'm not saying this is the only thing that when you have pain and swelling that you'll always have torsion, but I'm just saying these are some of the major signs and symptoms of this condition that we call testicular torsion. Now this is an interesting topic, because most of the time I've seen men coming to the hospital for the last almost more than 15 years I've been practicing. I've seen patients coming to the hospital above or more than 6 hours after the torsion has occurred, and there's very little that can be done, because when it's above 6 hours, most likely your testis is dead. You are lucky if the torsion only occurred on one testis, because when the surgeon goes in, he will just remove the one testis and you'll remain with the other one. But if you are not lucky that the torsion happened or occurred on both the testes, then what will happen is, when the surgeon goes in, the two testes have to be removed, and what will happen is you will end up becoming infertile. So the issue is, once you have this pain, do not ignore it, because we have many years I've worked in the hospital, I've realized men don't like going to the hospital. They always ignore things, and once they come to the hospital when it's too late. But kindly, as a man listening to me, please do not ignore such like pain, because we might just end up, if you go to the hospital, we'll just end up saving your whole generation, your whole village, your whole society, or a whole nation. So kindly, if you receive this information, share it, because I'm sure once the information is shared outside there, maybe someone is going to be helped. And if someone is helped, then we'll have a better society. My desire has always been, we'll have a better society, a society where I'm going to help my brother, I'm going to help my sister, because at the end of the day, we need you, you need me, you are my sister, you are my brother. And at the end of the day, I've always said, every time God has given us this information so that we can be of help to each other. God has given us this technology and these tools so that we can help you. And actually, even if a problem is there, my desire has always been that a solution is going to be found. I've always said ultrasound is a simple procedure. Ultrasound is a cheap diagnostic tool, something that is readily available. So kindly, if you have this issue, if you have this pain, go there. And what are we going to look for? What are we looking for in ultrasound? We just want to look at the size of the testis. Is it swollen? We want to look at the appearance, and we just want to make sure that there's blood flow. If the blood flow is not there, and all the features, all the indications points towards torsion, then we are able to advise the medical team that are attending to you, so that a medical intervention can be carried out, so that we can save your generation, we can save your testes. So thank you very much, and thank you for tuning in. Once you get this information, kindly share it so that someone else, or we can help people around us. Thank you, and have a great day ahead.